I'm frequently asked, okay, what's the solution though for hiatal hernia syndrome? I've heard what it causes and the symptoms, but what's the solution? What do I do? And I certainly understand the question, and I wish it was a one-word answer. So I'm going to get to that, but I want to give you kind of the history, if you will, or kind of the trajectory of what gets someone to the state of having hiatal hernia syndrome. Because remember, there's over 20 different symptoms associated with this condition. It's, yes, acid reflux and gas and bloating and often constipation, but then it's heart palpitations and shortness of breath and anxiety and panic attacks, and the list goes on from there. So there's a lot of symptoms. So what do we do? First of all, let's talk about what are the frequent causes. Often, not all the time, but quite often, we have patients who state an event. You know, on July 2nd, 8 years ago, I remember very well, and this was, they have a sort of a line in the sand, if you will, of they were fine and then they weren't fine. So the frequent things that occur are, I got food poisoning and I was vomiting very dramatically, or I had pneumonia, I had a really bad cough, I had a flu, I had a really, really bad cough, and if you've ever had a bad cough being ill, it can last for a very long time. So that the vomiting is very obviously dramatic, creating a lot of intra-abdominal pressure. Coughing creates a lot of intra-abdominal pressure. I mean, people can break ribs just from coughing. Another aspect of silent acid reflux is the acid tends to trickle up and end up at the top of the esophagus, and that can create a chronic cough. So that's another reason. But vomiting and coughing are due to the things I just mentioned, and certainly there can be other causes, but that's the start, okay? Now, in addition to that, you can have chronic constipation or chronic IBS or IBD, so constipation and diarrhea on and off, but something that's creating a lot of increased intra-abdominal pressure. So that's one of the sort of beginning causes. So then, the other aspect of this is that there are mechanical causes, because in a nutshell, what's happening with hiatal hernia syndrome is the diaphragm has been breached. Its structural integrity has been diminished. And that can certainly be because of the coughing, vomiting that we just mentioned. But also people who have a scoliosis, a curvature of the spine, that causes the diaphragm to pull differently on either side. Believe it or not, having a neck injury, like a whiplash, the nerve that goes to the diaphragm comes from the base of the neck. So you can have a neck injury, and that can set you up for hiatal hernia syndrome by creating an issue with your diaphragm. Also, the nerves coming out of the middle of your back, so you can have mid-back issues that are creating this. You can have hip issues. So the thing that's so phenomenal about hiatal hernia syndrome is that there's so many parts of the body that feed into it, okay? You have a muscle called the psoas muscle. That muscle begins with a P, so it's P-S-O-A-S. The P is silent, but the psoas muscle it extends from your lower back vertebrae into the internal side of your hip, and so you can have a chronic hip issue, and where that comes in is that there's also fibers that come up that go to your diaphragm. So there's so many aspects affecting the diaphragm. So we have the illness, or the chronic constipation, diarrhea, IBS issue. We have structural issues, as I've just mentioned. I'm looking down at my notes to make sure I haven't forgotten anything. And this is resulting in increased intra-abdominal pressure and a lack of integrity of the diaphragm. So that's setting us up for it. Okay, good. So now we have solutions, right? What do we do? Now, when it comes to the neurological things I mentioned, like the neck being irritated and the middle back being irritated, and the psoas muscle, which is a muscle, also the vagus nerve being irritated, we have to rebalance that, including the diaphragm itself. So we have a whole physical medicine part of our program that addresses that. Now, for different people, there's different degrees of this, so some people are much more of an internal issue, and some people are much more of a structural issue, and then some people are both, you see. So again, our programs are very personalized and customized because you got to get the job done, right? So you have to figure out what's going on and then get the job done and normalize these things. So on an internal level, what do we have? We have things that have created this increased intra-abdominal pressure. Remember, the diaphragm is the adverse effect of it, but what's creating that increased intra-abdominal pressure? We have imbalance of our gut, imbalance of our gastrointestinal tract. What kinds of things can do that? What you're eating. You've had chronically not the best diet. You have food sensitivities maybe you don't know about. You have organisms in your colon, so we're assessing the microbiome, the health of your microbiome. You have organisms that shouldn't be there. They're the bad guys, okay? You have toxins. You've been exposed to mold or heavy metals, and that's creating imbalance and inflammation. What else is on my list? Again, the history of diarrhea, constipation, IBS, IBD, any of these things have created that imbalance. You have fatty liver, you have diabetes, you have obesity. Now, don't get overwhelmed by this list because everything I've mentioned is correctable. Okay, type 2 diabetes, fatty liver, these things are all correctable unless they've gone so far, but generally speaking, they're correctable naturally. And then we have stress. Now, stress can just come from you have a stressful lifestyle, meaning, you have a stressful job. For whatever reason, life is bringing you a lot of stress. Your ability to deal with that and sort of have it roll off your back like water off a duck is not so good. I'm like that. My genetics are such that they don't have stress roll off me like water off a duck's back. So I've had to work with my genetics such that I deal with stress much better than I used to. But we have to address kind of lifestyle issues that we can, stress management, that's part of it, because stress affects your gut. So it's all back to the gut. And then lastly, hormonal imbalance, which could have been around before, or hiatal hernia syndrome is great at creating hormonal imbalance, because if you're in the shortness of breath, anxiety mode because of shortness of breath, heart palpitations, you're having panic attacks, it's really going to throw off the hormones. So then we have to reset the hormones. So you see, it's a lot, right? So is there an answer? Is there a simple answer? Is there a one-word answer of do this? Closest I could come would be two things, which would be normalize the structural influences that have affected diaphragm function and normalize gut function. So we're down to two, not single, but two. But then what is that for you versus the next person, And it's different. And that's why it's so important to learn about you and learn about your health history. As a kid, did you have a lot of antibiotics? Did you have a terrible diet? Did you abuse drugs or alcohol for a time? All of these things have to be taken into consideration. I mentioned my genetics. Genetics is something we look at too, if it's pertinent, you see? So our programs are completely customized and personalized to you, because you are you and you are unique. And just because you have this syndrome, hiatal hernia syndrome, doesn't mean that so it's one syndrome, one answer. No, it's one syndrome, personalized answer. What I love though, in addition to handling 85% of the time all these miserable symptoms, naturally I might add, we very rarely need to resort to drugs, is that while we're doing this whole program, things like fatty liver and diabetes and overweight and high blood pressure and AFib, these things are normalizing too, because the only way for this program to work is to look at the body as a whole. So you're really getting a whole body treatment, even though you might come in and just say, listen, it's just the acid reflux and the bloat, and I get some heart palpitations and those freak me out. That's all I want, right? But in order to fix that, we're addressing all these aspects of your body. So that's the beautiful part of it, is that for a, anywhere from a 3 to 5 to 6 month max program, we're really addressing all of you and improving your health across the board, because that's the only way this program works. So I hope that answers the question of what do I do? How do I solve this? You need help. You can't do it on your own. I couldn't do it on my own, and I'm an expert in this. I'm a complete expert in this. Could I fix my own? No. I'd have to do testing. I'd have to work with a clinician, because there's a reason doctors don't treat themselves. It never works. So you need help. If you want to try to Band-Aid it this way and that way, that's fine. It's your body. But if you're miserable and you really like the idea of really resolving this and getting to the root of why, and realizing that root cause is affecting other parts of your body as well, then this is very exciting. It's a lovely opportunity to optimize your health, and that's what I want for you. So consider calling us for a consultation. It's a 30-minute consultation, and you're talking to one of my team who are all expert in this, and we'll let you know if we think we can help. If we don't think we can help, we will tell you, because we are very wedded to your success. We want you to win as much as you want you to win. So we will not take you on as a patient if we don't think you're a good fit, and that does happen. So if you're ready to get well, we are certainly here and ready to help you.